given the constraints that our partners face. So in the case of Kenya, this, for example, meant that we had to integrate in a very fast-paced policy cycle. Moving on, then, the key research or the key question that I would like to be discussing today is something that builds a little bit on the conversation that we had yesterday around the importance of social registers, as well as the question around financing that I think we got into a lot of detail today. And I hope that this case study can provide some insights, in particular around using existing proxy mean test data, social registry data, to design an equitable contributory social insurance program. And I'll be using lots of visuals like this just to put this question in perspective. So ultimately, the goal of many of these social protection eligibility for programs or to determine contribution amounts. And the way this is usually approached, we've been through this in several of the conversations, is to use existing household level data on expenditure, on assets, to then predict, to estimate a ranking of who are individuals that are particularly worth including in that particular program, and to sort of use that ranking to target our programs. So what I will be talking about briefly is just bringing everyone on the same page with regards to how is proxy means testing used for eligibility purposes. So I plan to set the scene. Given this is a conference on social protection, many of us will be familiar with these concepts. We had a discussion before about inclusion, exclusion errors that also came up in the presentation just before. I just want to visually provide some examples of this to set the scene and to then think about how is this approach working out and what are the implications if we were to use a similar approach determining contribution amounts. So I think that will be helpful to have in mind. Before then, moving into a case study, and I will give you a glimpse of how this worked out in this case study from Kenya. And I'm saying I will give you a glimpse very consciously because I'll keep that context fairly high level, given some contractual obligations, to not speak about some of the details and some of the data. I'll still try to answer all of the questions that you have with regards to this, of course. I'll then speak about two brief model improvements that we introduced, where we collected additional data and we introduced an appeals mechanism that allowed us to really improve on equity and reduce some of the exclusion errors and misclassification, but I'll get into that. So moving into the sort of recap, if you will, eligibility and targeting for eligibility usually means that there is a steep cutoff rate in the benefit. So if we, that hopefully doesn't come as a surprise, right? But eligibility criteria just mean that some percent of the population receives access to a program or a service while another part does not, and we need to determine sort of those cutoff rates in a very equitable way. And I'm illustrating this just here for a hypothetical program where we're trying to target the poorest 20% of the population. Here generated by the PMT score, the proxy mean test score. So that sounds fairly easy, right, in theory. But remember that this PMT score and this ranking that we're using is just an estimation. It doesn't necessarily reflect which of these households are actually worthwhile and vulnerable, but it might suffer from inclusion and exclusion errors. And I will go through that visually a little bit. So, as I said, we actually do not know who the poorest 20% of the population in this example were. So what we oftentimes do in practice is that we're using information from the social register to then estimate a particular model. Usually it's some sort of proxy mean test model, whether that's linear or otherwise, to come up with these rankings. And the information we're using is usually coming from expenditure asset data. There has been lots of progress in terms of refining what we collect. We heard already before, we had a lot of discussion yesterday as well on the GAMBIA social registry, that being one of the most comprehensive, that having 100% coverage in the country, which is really critical, especially if we're talking about now the contributory schemes as well. So this is basically, just giving a sense of how these models work. And visually, what this looks like is basically illustrated in this graph. So what we see on the horizontal axis is, again, these predicted scores of wealth in the population, and the vertical line is indicating the poorest 20%. So everybody to the left of the vertical line is who we would like to include in the program according to our targeting exercise. And what the authors in this work did here is, this is an example from Rwanda, is to collect actual consumption data as well. So what we're plotting in addition to the prediction on the horizontal axis is the actual consumption ranking on the vertical axis. And then we're applying the same 20% cutoff to the actual consumption data, which means that everybody that's sort of below that 20% percentile in the vertical line should be actually covered according to the consumption data. So what this means now is that we're targeting some group of the population in the bottom left corner correctly, but we're also excluding a large part of the population. No, that's just by design in terms of how we're using a prediction to do the targeting. So the bottom right part is part of the population that is excluded by design, and then we're including a part of the population in the program to the left of this vertical line that actually, if we're looking at the actual consumption data, might not be eligible for the benefit. Yeah? So these are the inclusion and exclusion errors that we talked about. This is a particular strong case, and I can't speak to the case of Gambia. I haven't worked or seen, looked at the data. The general point that I'm trying to make, though, is that the general point that I'm trying to make, though, is that across programs there has been a lot of research on the extent of these inclusion and exclusion errors, and this is an example from Indonesia here, where stakeholders undertook, again, a really well-researched pilot targeting exercise to demonstrate the effectiveness of this proxy mean testing mechanism. I think this is taken from a document with the Australian aid agency that then assessed sort of the effectiveness of different programs. And what they found is that across the lowest 30% of households that were eligible, only about 50% or so were correctly targeted. So there's a massive gap in this segment of the population that is actually targeted by this transfer, by this cash transfer program. So now this is not to say that proxy means testing is all bad and that we're lost. That's not the point to say here. So as Anne said in the prior discussion, any targeting will have exclusion and inclusion errors, but it's really important to be aware of these dynamics. And again, I can't speak to the state of this problem, to the extent of this problem in the context of the Gambia. I haven't looked at the data, and probably even if I know this is a high-level conference, I wouldn't be saying it. But I think it's something to be aware of. And moreover, I think it's also important to mention that there have been various attempts to increase the precision of this targeting exercise. We spoke a lot about already participatory processes, getting community involvement to validate those ratings, as well as integrating a KIDS mechanisms. So there has been a lot that has been done in terms of reducing these errors, but from a purely technical perspective, which is often the perspective that we take in our work, we're trying to fit a very prescriptive model to very complex multidimensional data, and these errors will happen. Okay, so far, just for the setting the scene. What I would like to talk about now is basically how proxy means testing data could be used for determining contribution amounts in contributory social insurance schemes. So we go back maybe to the illustration that we had before. Here we go. Where we now talk about a contributory scheme where we require the richest 20% of the population to cover the full cost of the benefit, and then as a government subsidize the contributions for other parts of the population in different buckets. Right? And this is just an illustrative example where we go down to having the poorest 20% of the population cover about 10% of the cost of the program. Right? So this is another, just an illustration of this contributory scheme. So now, from a technical perspective, the question then becomes, how do we find out which income bucket or which income group a given individual falls into? And again, from a technical perspective, there's two ways to think about this. Where the first one is that we would like to estimate a precise income measure and then use that to like rank people in the categories. And the second one is that we would directly try to predict which of these categories a certain individual is in. So one is an estimation problem, the other one is a classification problem, and that's from a technical perspective, again, different models that we would be applying, and some of them might have advantages over others. So this is again just focusing on highlighting the importance of the model here for determining these contribution amounts. Now just a couple of points that I might have mentioned, right? We said these PMT models are typically used for targeting rather than as a ground truth measure of income. We also said that these models try to explain variation in consumption mostly in consumption. And these models generally are they're not perfect. No model is perfect, but some of these models have been shown to be particularly bad. And what I'm showing here is a graph for, it's from a somewhat dated document again, but that was assessing, again, the performance of these models across different countries in Rwanda and Bangladesh, Sri Lanka, Indonesia. And what we're seeing is these red dots. Again, those are the predictions that are coming from our PMT model. And in all of these contexts, a lot of resources have been invested in getting the actual consumption distribution. So that's the blue line that we're seeing. And what we're seeing across these contexts, what's really important to understand is that we're underestimating scores for higher income households. Yeah, so all of these dots are below the blue line on the right end of the graph, but we're overestimating the consumption for the poorest in the population. So that is just a technical conclusion. Again, it's a result from the model. But what this means is that for targeting work, this drawback doesn't necessarily affect our implementation, except for the inclusion and exclusion errors that we spoke about. But if we're thinking about a contributory scheme, there might very well be implementation problems because we're skewing the amounts that, in particular, the poorest parts of the population would have to pay, and we're inflating them. So from an equity perspective, we're disadvantaging those that we actually would like to support through the government subsidy of this program. So knowing this, therefore, in this case study that we're now going to move into, we were interested in what can we do to address this problem? How can we change the models and the underlying PMT approach to increase fairness and equity, in particular for the poorest of the poor? That was really the objective of our support. And with that context and theoretical underpinning, I would like to now move into the case study from Kenya. So again, I keep this high level, but happy to try and answer questions to the extent that I can. So the Kenyan Ministry of Health instituted a contributory social health insurance scheme that would include contributions from both the formal and informal sector households. And the plan for these contributions was to be proportional to the household income. For formal sector households, reported income is something that's known and therefore would be used. And for informal sector households, income was to be determined using this PMT model. In our role, we now supported the Ministry of Health in designing and implementing this model. And the ministry used a household budget survey data set that included information about income and other indicators to train the original model, to like do the PMT exercise. And our focus, as I said before, was in particular to increase equity for the poorest part of the population. And that meant thinking about how can we reduce the overestimation of income for low-income households in particular. And then we engaged in additional data collection exercises, focused on particular poverty pockets across the country, and I'll get into that a little bit more. And we also introduced a somewhat automated appeals mechanism using the data that was available to us. So again, we'll be looking at just the setup with this visual that you're already familiar with. So again, now the context is that the existing model that the Ministry of Health proposed to be used was a model that just was a single model for all income groups, one model for the population. So that meant that we would be using all the data available to us to use the same weight for all the information that we have and predict income levels. And these income levels would then be used to determine contribution amounts. So that was the initial idea, the initial approach. And that approach posed several methodological and also equity challenges. And those are listed here, and I want to go through that. So again, having one single model for all income groups, we already saw that, will very likely lead to the underestimation of high incomes and to the overestimation of low incomes. So there's a massive equity consideration here. But also using the same set of indicators for all income groups might not be the best choice, because not all of these indicators might have the same informative value across different incomes. So if somebody owns a TV, if somebody owns, like a Kubota, if somebody owns a car, that is information that might be very different across income groups. The third aspect was that it also didn't allow us to disaggregate and look at model performance by income group. That is something that is very difficult to do if we have a single model, and therefore it also prevents us from making incremental improvements and updates to model performance when we're looking to improve equity. Okay, so based on this, what we did to overcome those challenges with the existing PMT model was to develop a two-step model that would first, in the first step, predict high-level income categories. So is somebody low income, middle income, or high income, right? So those are just like a general classification. And what we would then do is to develop group-specific models that, in a second step, would predict very granular income groups. So you could think about, in the low income proportion, or in the low income group, is a household earning maybe below $1,500 per month, between $1,500 and $3,000. So those are like very, very granular income groups. And those income groups could also then vary across these high-level categories. So for higher income categories, those intervals would be much larger. So that's basically the innovation that we did. Hope the visual is much clearer than all the code and all the data that goes into that. But that's the basic idea. And this really, I'll keep this short, allowed us to overcome several of the challenges that we spoke about. We now have multiple models that are allowing us to do separate model improvements, to incrementally look at performance, and to give different weight to different information for each of the groups. So that's very technical. I'll just go over that briefly, but importantly, it allows us to look at equity, because it allows us to focus on the group of low-income households that is most at risk to be disadvantaged by this approach. And second, it also allows us to inform the contestation, the appeals mechanism. So yeah, with that, maybe we can look at some of the results now. I think that's something that you've been waiting for. So what I want to say is that before interpreting the results here is that I am choosing to show you results for a part of the data set for which we know that all of the households are low income. Okay, so the goal really is that this bar on the left here for low income households, we know that that is 100%. That's the truth. Okay, so that's something that we did for the additional data we collected, and that's the cut of the data that I choose to present here. But what we see is that the original model that is here illustrated on the left bars in purple, that in the original model only about 18% of households were classified as low income, even though all of them were actually low income. And this is an artifact again of the model, because there was a large proportion of households in the middle income groups, so a lot of the model was biased towards that segment. What we then also see is that this updated two-step model that we developed produced a significant improvement. About 70% of the households are now correctly classified as low income, while we reduce overestimation for these middle income categories here. So we're massively reducing exclusion error in a targeting setting, if you will, but here we're basically categorizing on the higher level. Yeah? In the first sort of like step, low, medium, high income households, we're reducing misclassification, and therefore we'll get closer to the accurate amounts that should be paid for by these households. So while an improvement, still we're only at about 70%, and the goal is to get to 100%. So what we thought about is how can we get closer to 100%? And this is really where these model improvements come into play. So I'll briefly talk about what we did for those. So to further improve equity, we collected additional primary data. So that comes at a cost, of course, but it's a fairly small sample of about 2,000 households that we sampled across 8 counties in Kenya. We worked with the State Department for Social Protection to identify poverty pockets in those counties. So it's not a representative survey, because we wanted to really purposely sample low-income households to be able to further differentiate between low-income households. That's what we saw in the graphs before. You know, the curve is really flat. It's really difficult to further differentiate those households, and therefore we collect indicators that are similar to those included in the Kenya Integrated Budget Household Survey, a standardized survey that's conducted in regular amounts of time. But we also included additional indicators around occupational status and agricultural production, agricultural land. In addition, because we felt that that would allow us to differentiate these households in the low-income proportion further. So again, we had limited resources and time to conduct this, so there's certain things that are just out of scope. We didn't collect any nationally representative data, therefore we can't think about model performance overall, you know, for like medium and higher income groups, and also we're not able to look at very granular estimates of accuracy across income groups. So these are more technical aspects here, but that's the data collection that happened, and then the way we used this additional data was first to implement fine-tuning of the second stage model. And I'll show you that in a second visually again. But we identify indicators that provide better prediction results for this underrepresented population. That's the first one. Second one is that we can tweak the model. We can drop uninformative indicators. Not all the indicators have the same information across these income groups. You know, in the higher income groups, for example, everybody would own a TV. Most would, you know, in the high income group would own a car. So that information, you know, might not be relevant for the second stage models. We can really tweak those models to be more specific. We would also be able to change model predictions post hoc, so afterwards we could sort of make specific changes to better reflect what we see in the ground truthing. And then we can sort of predict with the additional data how well is our model performing. And therefore we can get a sense of how well would it be performing if we were to roll it out to the general population. So again, it's an additional investment and resources, but our hopes were really that we were able to increase equity with those efforts. So visually now, what I said is that we focus in particular on the low-income segment of the population. So these model refinements and post-hoc corrections, they're really just for the second stage model that I spoke about. And also the appeals mechanism that we introduced is only for the low-income household group. So this appeals mechanism allows us to build in predictions about how certain we are that a given individual falls in a given income category. So am I earning below $2,000 a month or between 2,000 and 5,000? We cannot have an estimate of like how certain we are about those categories. And if a person then appeals, they need to provide additional information, and the information that the individual provides, in addition to the information we already have and the certainty that we have, allows us to somewhat automate this appeals mechanism. And maybe then looking at the results of those two additional model improvements, we again, so like take this step back, we know we want to get to 100%, right? That's the goal. So in green, it's the third bar. On the left, we see that we're now going from about 70% of households classified correctly to about 80%, around about 80% of households that are now classified correctly with the additional data and the corrections to the model that we use. But what really changed the quality of this prediction model here, classification model, is this appeals mechanism. And that is something that has also been shown in the literature. Using that information, introducing appeals mechanism will allow us to introduce equity. Now, in a case where we're talking about contributory schemes, of course, we need to be aware of the different incentives that there are to provide specific information that might bias and contradict the information that we already have. So that is just something to be aware of and how it worked out in our case. And maybe with that, I want to conclude with some high-level takeaways here that are really just about, generally speaking, P&T approaches tend to lead to significant inclusion-exclusion error. That's nothing new. We know we need to deal with that. But what is important is that those are disadvantaging the lowest income households, and we need to be very careful, in particular when we're trying to use social register data for contributory schemes. Because these models differ so much, it makes a huge difference. And conventional approaches likely won't get us very far if we're trying to design contributory schemes. Our focus here, as I said, was mitigating model bias, ensuring that the contributions for low-income households are as fair as they can be, not on optimizing overall contributions or model precision. So, if I'm a policy designer, there's a cost involved in this, because what we're doing here is that we're reducing the cost for low-income households while we're not increasing the cost for high-income households. So there will be, general financing questions coming as a result. And second last point is really, even with moderate investments and like further model tweaks, being really careful, using additional information, we were unable to get to 100% model accuracy, even though we see massive improvements in taking a different approach than the conventional simple P&T model. And the last one is really, as I said before, we saw in the data, this appeals mechanism that allows citizens to contest the distributions that are determined by the model, allowed us to further improve on equity, and is definitely something that we would love to see included in such policies. Now, how things worked out in Kenya, we don't quite know. We weren't involved all the way through. Some of these results were very contentious, and therefore, happy to discuss that more. I think we have someone familiar also with the context very much. So with that, thank you so much. I'm happy to take questions.
Thank you for the presentation. I really enjoyed it. I guess the thing that comes to mind and something I'm quite curious about now is you said you did a follow-up survey to get additional data to have, especially amongst the poor, to help you differentiate and discriminate between different levels of the poor. I was just curious, what were the what were the things that helped you differentiate between people who are amongst, all the poor people? What were the factors that you could use to discriminate amongst them?
Thank you very much. Quite interested in this work. Again, like I discussed with you earlier about the high inclusion and exclusion error. But I just wanted to, because after adjusting the model, taking into account the low income categories, that is post-hoc and post-appeal, I saw that the prediction was very high, close to 100%, even though the objective was to have 100%. Now, I hope the tricks that you did in the post-hoc and also following contestation is not also overly estimating the level of poverty among that income group. I'm saying this because if you use this model in the Gambia, for instance, we have a social health insurance program which is likely contributory and non-contributory, particularly for some categories of population that will be subsidized by tax funded. But I'm just thinking that I hope the effort to increase fairness and equity is also not leading to overestimation. And if that is a possibility, how do you also control this? And in the Gambia, we are at a stage where we're thinking of introducing premium for formal sector workers, informal sector workers, and those that are self-employed. Likely, we are relying on some population willingness to pay estimates. So maybe some perspectives on maybe what Gambia can do to improve premium decision making.
Okay, thank you very much. Very interesting presentation. Just wondering with regard to the validation of the model, if you, there is a process of validating, with the communities, looking at reality, what really, what is the situation. And I think one of the questions I wanted to ask as well, the investment that is required to have this. Maybe it's linked to some specific, social protection intervention, but not really, because some intervention really target the poorest group, and when with the PMT we have the poor, and the exclusion and inclusion can be a little bit, minimized because of the fact that we are targeting that specific group. But anyway, there is a reason why as well we are targeting that group, because linking that to the fact that there is a high probability of having a very low consumption when you are in that group. But what I'm seeing here as well, you can have some bias. And understanding as well, and this is another element that sometimes we face is, okay, some indicators like consumption are kind of very seasonal and can be affected by, the situation or the data point. So, and really think how your model can help as well to minimize that, because why we think PMT sometimes can be very robust and useful, because if you link your targeting to the consumption, the bias even is really partly in terms of inclusion or exclusion, you understand, depending on the point of time of your data. So that's what I wanted to add. Thank you so much for the presentation.
Yes, good afternoon. Thank you very much for your excellent presentations. My name is William Diada. I work with the National Social Protection Agency. I was particularly interested in knowing, based on the PMT model that you use in Kenya, I would be interested to know, for example, the parameters that you use to rank the population into various income groups. Thank you.
Okay, good afternoon. My name is Kathleen from Nana. Regarding the PMT, I just want your experience, because we had the opportunity to use the PMT during the NAFA, the SSMP, and our experience has been that during the validation process, where when the list is shared to the beneficiaries, to actually look within themselves to see whether the outcome of the results is really the reflection of the members of the household. But what the experience has been, people will just accept it and say, is their luck. We can't, it is their luck. These are the names that we have. But it's hardly for you to see somebody sincerely come out to say that, yes, indeed, even though my name came out, but I think there are people within the community that are better off. So I don't know whether what has been your experience in terms of other countries, whether the issue of inclusion and inclusion has worked out. But here, not much is being done. Under normal circumstances, people will just accept the results, even though they might complain outside, but not in the presence of other people. So probably you can throw light on that. Thank you.
So it's like the one is pleading with a given chance. Let's take the last one.
I'm Ibrahim Assise from the Social Security and Housing Finance Corporation. We understand that PMT is about estimates, and Gambia is a unique situation when it comes to PMT issues. In most of the time, for example, if you go to our rural areas, you will find a person in a very good household or in a very good building when actually that person is actually poor. And you will also find a person in a setup, in a poorly managed setup, but when actually that person is rich. So how can you balance, especially the data collectors, in terms of PMT?
Thank you. Over.
Yeah, great. Thank you so much. These are very good questions to ask. I'll go back to some parts of the presentation to answer them. I think I'm just going to take them in chronological order, starting with the first question on the additional data that we collected. Here, yeah. So there's the general data that we collected is very similar to the standard budget household survey, Kenya Integrated Budget Household Survey, KHBS, and all the modules that go into that. Right? So it's expenditure modules, asset modules. Additional information that we collected was around occupational status, what type of work is being done in the household, in what types of sectors, that informal laborers, is that agriculture, subsistence agriculture, is that being wage employed on somebody else's field, so on and so forth, is it work on own property, own land, that's sort of like the combination around agriculture and production. And so that's what we felt that in a lot of particular rural settings was able to help us differentiate. It was like, is any land owned, what extent is being owned, and how is that land being used for subsistence and or more productive income generating activities. So that's about the level of detail that I can go into that. There is, of course, looking at the just like geographical distribution and expansion in Kenya, there is a lot of variations across that. So we did it in 8 counties, not across all the 47 counties. So that I think is really important to mention. And then there's policy, there's political choices involved in a lot of these, in terms of like what is measured and how it is being used. So that I think is really important to be aware of. But it's related to this point that I think came up as well just before. I think this graph here is illustrating this really well. So I think there were several questions about what are the PMT variables that we're using. So I think that is the same question that it's related to the question that I just answered about the information that we collected and that we used. That information is the same across all income households, but what we're basically doing is we're trying to, from a technical point of view, maybe just segment like this distribution and estimate different models that fit better. And therefore the same information has a different weight. Right? So if I own a certain list of assets, if I have a certain expenditure pattern in a more rural setting, that really sticks out. Right? So that allows me to then classify somebody as higher income in a lower income proportion. So that is sort of how we were thinking about splitting these models up into 2 steps. And then what our colleague from NANA was asking about in terms of inclusion, exclusion errors, and I think also our colleague from World Food Program, sort of the bias among the poorest. So what we see is that these models, they're very flat, especially among the poorest segment of the population. So whether somebody is included or not can sometimes be pure chance. Right? So there's a lot of restricting, basically. There's always more of a demand for social programs than there is supply. There's more resources, more people being willing to receive those resources and in need than there is supply. Now we had a conversation expanding to 30,000 households, but probably there is hundreds of thousands, 150,000 households that would probably be eligible to receive. So in a sense, this is a rationing exercise. And then, as you mentioned, reducing inclusion error is much, much more difficult than reducing the exclusion error. Exclusion error is being able to predict this better, but the inclusion error, as you said, requires validation, and it's very rare in community settings to find an individual to say, okay, no, I'm actually not eligible, right? Because that is also something that undermines the cohesion in the community oftentimes. So yeah, I think that is a really, really important observation, and it speaks to the importance of the community involvement process that I think both of you were speaking about as well. In the case of Kenya, that is something that it is something that we were discussing. It's not something that in this exercise was conceptualized, because it was not meant to be a targeting exercise, but it was meant to be a classification exercise. And there was some willingness to sort of advance that on the policy agenda with existing data that there is, with no additional resources necessarily invested into that. But it's really important to do that, and I think the initial dialogue about what are the policy objectives is really important to have in terms of getting that right and anticipating the community response as well in terms of how is that perceived. So those, I think, are some of the points that were mentioned. And then I think there was a point around seasonality of consumption. There's a point about how dynamic is the data also that is being captured. Absolutely, I think that is critical, and I think it goes in line with the presentation that you gave yourself around the adaptation. And we know that there is seasonal variations, there's lean seasons. How do we respond to that? What are the supports that exist as part of the social policy framework that can be integrated into that or not? From a model here, it's very difficult to do that. I mean, there's organizations that do have more regular information about a part of the population, but there's significant exclusion in that as well. There's organizations that have digital agricultural extension services where it is much easier to be interacting with that. And it speaks to, I think, the point on interoperability of systems that was made before. What warning systems exist, and not just warning systems where it's a one-way push of information, but maybe how can you get to a model where there's a two-way stream of communication between citizens and the government, if you will, or the state, that allows for an easier exchange and update of information. One other thing that we're currently discussing and speaking about, and I think many social registers face that, is once we get updated data for one part of the registry from a program that has targeted group of eligible individuals, there's more information that's being fed back in. Here we collected additional information for some group of the population. The question then is, how can we use that information to predict how the remaining part would have evolved over the same period of time? So that is something that will introduce additional errors, but it is at least something to introduce some kind of like dynamics into the social registry, and at the same time make it even more complex to potentially risky to understand. So that's something that we're currently thinking about as well. And yeah, I think that's those points. I think there was one question now from our colleague on from the health insurance scheme around willingness to pay, moving towards the transition of premiums. I think this is a prime example of that. It's the same. It was about what should those premiums be. Was one approach. You mentioned willingness to pay studies and sort of like the ways or the methods that we could apply to get a sense of what's best in terms of financing this reform. Willingness to pay studies, I mean, it's willingness and ability to pay, I think, is one, right? So like the way I like to think about it is, going back to like the discussion even in the morning, this is just another source of domestic revenues, and I think this is a policy choice around how redistributary should this be. Do we want to put a higher burden of financing on those that are maybe able to pay or not? Right? So these are the approaches that would allow it to do us and would allow some cross-financing of subsidies. But this is really, I think, a policy discussion. From a technical point of view, yes, there's willingness to pay. There's different ways to get at revealed versus stated preferences. If I just ask you how much do you want to pay, your amount will be very low because you probably don't want to pay. But there's ways to like figure out that willingness to pay in an incentive compatible way, so meaning that it's closer to the actual truth that that person is willing to pay. And we can maybe discuss that. I think it's more on the technical side. Yeah, so I think overall, hope this was answering all your questions, and again, huge pleasure and honor to be able to speak about this work. So thank you.
Thank you very much, Mr. Fisher.
Thank you very much, Mr. Fisher. And thank you as well, delegates, for your questions and comments on that presentation. Our next presentation, as we've had a case study from Kenya that was just showing us the refined classification of household income based on PMT. We will have another presentation, and this will show us how mobile money has revolutionized social protection delivery. This is also a case country presentation, a Kenya case country presentation, and this will be done by Mr. Peter Mbasa. He's the Senior Social Protection Specialist from Kenya. So, Mr. Peter, the floor is yours for your presentation.
Thank you so much.
That's the slides. Oh, you want us to control it from there?
No, I can control it.
Perfect.
And it help us to hear the podium. The cameras are taking you on live. If you go out of the podium, the voice will not get it. All right. Thank you so much, and good afternoon. I am aware I'm standing between yourselves and lunch, so I have to be very conscious to make you look at me on one side and to make it as interactive as possible. I want to believe that my brother Fisher has basically talked a lot, but truth be told, left, right, center, or even north and south, universal social protection is the best. The PMT is good because you don't have money. If you have money, go universal and the problems will end. You won't have a challenge because I know that when we started the programs, I was there in 2004, we were telling our beneficiaries that the computer has thrown you out. And we wouldn't want Gambia to go that direction. If it's possible, if you have money, run a universal program, our problems will end. Maybe you'll have a little exclusion errors, but inclusion errors will not be there. I want to believe that our discussion is going to take basically about 20 minutes, but for the purpose of this discussion, allow me to pose two very important questions so that we reflect on them as we go through our presentation. Number one, how long should governments support its population with cash transfer programming without graduation? How long? The second part of it is, are cash transfers sustainable in the long run, especially with the shrinking physical space and reduction of donor support, more so in low-income countries? Are they sustainable? It's a thing that we need to think as we come to this conference. This conference is there to basically give us a direction of what other people have tried to do and failed, so that when you try to do, you just learn from the mistakes they did, so that you can make yours a better place that people will come and see. I had prepared a presentation of more than about 17 slides, but I'll talk to about 4 or 5 slides so that we become as interactive as possible. That could be the outline, but allow me to put one caveat, which is very critical. All cash transfers to the poor and vulnerable people in the community are 100% tax financed by the government of Kenya. That is a caveat. They are 100% paid by the government of Kenya. So the reason is we've learned the hard way, we've made the hard mistakes, and we've decided that we have to go the government way because we can control ourselves, we can ride left, right, and move the agenda. As I said, we have 3 cash transfer programs, and you realize I'm going to concentrate only on the payment system. Thank God the organizers of this conference have organized it in such a way that the PMTs, the financing, the identification, the targeting, all has been done by other colleagues who are either in country or outside the country. So I'm left with a case study of Kenya, especially on mobile cash transfer programming. So just a precursor, we have 3 cash transfer programs: the older persons cash transfer, the CTOVC, and of course persons with severe disability cash transfer. I'm trying to emphasize severe disability, not disability, severe disability, one who requires 24-hour support. So just a quick thinking about it. All our the Ministry of Labor is the one responsible for cash transfer payments, and starting 2023 July, we were using the bi-monthly. We started the monthly when our colleagues came for the conference, and I was telling them that the conference is a strategic way of making sure that you gain support from the political angle, and of course you are able to move. During the conference, we had 2 very, very particular objectives. 1, to increase the coverage, and 2, to make our programming more viable in terms of increased funding towards operating cost. But we only received one part of it. We increased the coverage from 1.2 million to 2.5 million beneficiaries, the population of the Gambia. Imagine, that's what we pay. So, other than the normal cash transfers, we also do complementary programming in terms of nutrition improvement through cash and health education, and an economic inclusion program that is supposed to graduate the beneficiaries from the normal cash transfer to IGS. That's why I asked the question, will we survive without graduation? Let's think along those lines so that we are able to move. I'll basically concentrate on this slide so that this is a pictorial slide. I'll concentrate on this slide, then talk about the advantages, what we learned, then go to the mobile money. As we started the cash transfer in 2004, 2005, we were paying through the district treasuries, which is our officers located in all the districts within Kenya, were paying the beneficiaries through cash. Money was sent to the district treasury, then the normal processes of getting money from the district treasury is given to the officer, and the officer goes to pay. Remember, this is money, and the chance of you being tempted is close to about 90%. Therefore, they could pay, and the balance could get its way out. We realized this problem is going to be more big. Therefore, we went to step 2. We contracted a payment service provider. By that time, it was called the Postal Corporation of Kenya. It's now defunct. And it was paying on our behalf. Still, the challenge was the same. The beneficiaries were going to the post office to collect money. I'm happy that I saw a post office around, so I'm talking something that is also relevant to this place. So the distance was big. That's number one. The number two, they also had their own challenges. There was a lot of money that was left behind. When they are reconciling, we realized that the person who said we collected money didn't ideally collect, but there's a signature. So you can see all those mistakes. You know, every time we were learning how to manage ourselves. Therefore, we decided, let's go digital a bit. We went to step 3. We got a 2-factor authentication program. Now we gave a commercial bank, which was Equity Bank, and of course, Kenya Commercial Bank. Equity Bank is fully private. Kenya Commercial Bank, the government has got 51% of the shares, so it's almost government. So we gave them the work. There was also another challenge. Reconciling the accounts vis-a-vis the money sent was also another challenge. But it was better. We were not losing money. But remember, the program was expanding. More people were coming. The amount of money being pumped to the beneficiary is also high. Therefore, there was need to expand these particular banks to more banks. Therefore, we took another 4 banks to make it 6. Now we had 6 banks paying for our beneficiaries. However, they were competing with the same beneficiary. But we had to put things into perspective, so we had to standardize. If it's customer service, same. If it's the commission, same. Everything was basically the same. So the customer had a choice. The beneficiary had a choice. If PCK is there and it's near me, the services I'll get in PCK is the same services as the one I'll get at Kenya Women Finance Trust or National Bank or KCB or EBL or other banks. The same thing, we had all the banks, 2-factor authentication, and you were choosing. So the beneficiary was a king in making sure he gets the best. But after the conference, things changed. We went from 2 months to 1 month. The cost of transacting slightly went up. There was need to think, how do we move this agenda? Therefore, the mobile service provider came into thought. Allow me to move close before I talk to the mobile service provider. I'm rushing because I've talked about this. Allow me to talk about the challenges that were there before we move to the mobile service provider. Number one, there was overcrowding at pay points during payment because all our beneficiaries are poor and they were thinking that money could end even before they collect theirs. So they would rush the bank and queue the whole day. Some could even sleep in the bank because they were not sure whether that money could be there tomorrow. So that was a problem. Then the agency network was low. You know, most banks are in towns, like now most of your banks are in Banjul. In the villages, not so many are there. Assuming the distance is 100 kilometers, somebody will not go back with the, you will have to sleep somewhere in the corridor of the bank to get the money the following day before it goes back. And you know, banks open from 8:30 to 4. So all those were challenges. Then there's also a problem in establishing the proof of life, whether you are alive or dead, especially for the CTOBC beneficiaries and persons with disability. And of course, high cost of transfer was there, inadequate budgeting for the commissions that were given to the payment service providers, and of course, the cost of collecting funds in some places were higher than the stipend itself, because you realize the stipend was about 2,000 shillings, but the cost, transport and everything, you could spend about 1,500. So by the time you go back to your house, you only have 500 shillings. Lastly, there was security concerns. The muggers, the thieves, all those young crooks and boys who are at the banking hall waiting. The old man comes out, then there's a crook who is there waiting for them. They could be robbed. And of course, some could be cheated, because that's part of life. Therefore, what did we want as a government? We wanted a system that is quick, covers those in need, that has less duplication, that is more cost effective, more predictable, and more sustainable. That is what we wanted. This can only be found through a payment service provider. Therefore, in 2024, July, there was a presidential decree that all the money that we pay for the cash transfers should pass through their mobile phone. Unfortunately, it should pass only in one mobile phone, which is Safaricom. Of course, we'll talk about that later on. And we've done all payments up to August 2025. We have around 1.76 million beneficiaries who have received their money through the mobile. The advantage, we have close to over 300,000 M-Pesa agents. You can pick money from as close as about 50 meters from your house, so you don't have a problem, and money comes to where you are sleeping. You don't even go anywhere. It comes to your house, no maga, unless you don't know how to get the PIN. That is when you get your son, your grandson to be able to get the PIN for you, and you are able to get that money very fast. Of course, in terms of disbursement, we've disbursed around, we disbursed about 3.5 billion, so it's close to about 42 billion in every particular month. Let me not talk about the pros and cons, because I will leave this presentation behind. I'm conscious about time, but allow me to quickly look at what are the positives that we add and the negatives in the M-Pesa. Even before I talk about this, how does this money come to you? It's very important that the beneficiary must know how to convert your M-Pesa number to be receiving money from government. And we tried to remove all our money from commercial banks. The reason is we want to reduce the cost because the commercial bank will take the money, will get the cost and the rest. So we decided that for government to run its programs well, we used what we call the e-citizen platform, which is a government platform where all the money is sent to the e-citizen, and the e-citizen transfers money to the Safaricom platform. Safaricom platform is the one that has the M-Pesa numbers of all the beneficiaries. So from there, they transfer money, and the money, the transaction cost is the same transaction cost you use when I normally transfer or any other person can transfer to me. If you're transferring more than 100,000 shillings, you'll only pay 108 shillings. So if you're transferring 2,000 shillings, you'll only pay 33 shillings. Earlier on, we were paying 107 shillings to the commercial bank. So there's a reduction in cost, a reduction in suffering, and of course, what we call the trust in government. What are the advantages, or what are the key challenges that we got? Number one, reduced costs of transfer on the M-Pesa. As I said, we are using the platform of M-Pesa, and of course, e-Citizen is a government platform, so there's no charge. Number two, reduction of time wasted in collecting of data, because all the money comes to you at the comfort of your place. And number three, increased use of resources within their reach. And number four, reduced insecurity to the beneficiaries, no muggers, no crooks, no in between and the rest, unless it is your relative who you gave the PIN and you gave the phone. So you don't need to complain. Even those kind of complaints, we tell you, no, that's your son, that's your daughter. So ask him to return your money. Then, of course, increase trust in government. Our programs depend on trust on government. But then we have a challenge with this particular system, and I want all of you to also think closely as you go to implement programs under the cash transfer, especially if you're going mobile money. Number one, there is a possibility that the touch between the officer and the beneficiary will completely cease. Completely. Because now if I'm a beneficiary and Fisher is an officer, money comes to me, he doesn't know. And even if I have a problem, I can't go to him. I have a complaint system in my phone whereby I complain direct to the service provider. The service provider will tell me the money is on the way coming. So the touch between the officer and the beneficiary is cut. Now, what will happen when you don't have a touch? The complaints go low. Even if the complaints go low, how do you know the progress of your beneficiaries? Whether they have improved in life or they have not, you will not know. Therefore, that's a big challenge that we are seeing now, because even the respect that was there, now it's not there. He will tell you now, who are you? That's the question, who are you? To this program, who are you? You are nowhere, because I get money from Safaricom and money comes from the president. So who are you in between here? You are nothing. So that's a challenge that is there, and we really need to think about it as we close this discussion. Other emerging issues are inadequate physical space for SP to ensure comprehensive coverage. There's also weak private sector partnership, weak systems integration for efficient programming. This was a big issue that we realized. The payment model also is a little bit challenging, and it's not more responsive and accessible. And of course, the issue of complaint, the two-way system, engagement system is also challenging, because now the beneficiary doesn't see whether we are what. And of course, other issues are system integration. Databases are supposed to talk between the single registry, the National Registration Bureau, and of course IPRS. And of course, one of the next things that we've realized is that we're continuously increasing the beneficiary. But then, programs cannot run without impact. We intend to do continuous impact assessment on the studies to come up with better results in programming, because that is the direction we need to go. Thank you so much. I've shortened it so much. Now I'm ready for many questions before you tell me you want to go for lunch. Thank you so much. Questions now. You realize I jumped over 10 slides because I wanted to make sure that I cover more space.
Thank you very much for that, Mr. Peter. So just as you mentioned, because we have lunch in a few minutes, we'll take 2 questions. Yes.
Allow them to ask us many questions.
So we have 10 minutes.
Welcome, welcome. Okay. Kindly your name, please, so that I respond to your name.
Yes, my name is Ibunget. I am from the regulator, just like the communication regulation. We have public utility regulation program. Basically, we have a concern, especially when it comes to mobile money transfer. You have said there was an official communication that all cash transfers should be received from M-Pesa, meaning like you are using one single money transfer system. Would that not lead to some kind of favoritism on the side of the mobile telecommunication Safaricom? Because what about the other forms of mobile communication, mobile money systems in the country? So that can also tie up your beneficiaries if Safaricom is not their best option in terms of telecommunication services. So I think for the Gambia, maybe if we have to do it, it should be liberal and not to one system, so that any form of mobile money system that we have, that the beneficiary has, he or she can use it. It becomes more complicated to do the transfers, but I think that is better than tying it to one mobile money, and then consumers have to, or the beneficiaries have to go to that. But also in terms of regulations, it will not be fair on the other side, on the other operators who are within the market. Thank you.
Quickly, thank you very much for that wonderful presentation. But again, we know that Kenya, in terms of literacy level, is so high. In the Gambia here, it's a bit of a challenge. Even though we know e-money is the way forward. But some money will go into their mobile phone, they don't in fact know that the money is in there. And we have had the experience whereby, because if your line number that your money is being paid is not functional for a period of like, let's say 6 months, that line is being given to another person. So I don't know what happens in Kenya, but as Gambia is concerned, those are some of the challenges that we have. Some people will not put credit in that line for a very long time. So with the e-money, the experience we had, some, like as soon as they receive the money, they will remove the SIM card, go and put it somewhere. In their mind, if the mobile gets lost, everything goes. So they will take the SIM card, put it somewhere, and then they wait for the next cash transfer program, and then they will put in the SIM card. So we had a situation where, like every now and then,
Personal touch.
Because it's key. You cannot run a program without knowing the perception, the people that you are dealing with. So that is a disadvantage that you elaborated. But if you want to take a kind of behavior in those people, and that interface is not there, what do you do?
Okay.
Do you understand?
I got you, right?
What the reasons for you to be able to move forward. But again, as I said, there are a lot of lessons that we have learned from you. But again, the other side of it also, the literacy level is so low. Some of them are being supported. We have seen a situation whereby, like, we know that we are not educated. Some of their family members will go and cash out the money. You understand?
That's correct. That's correct.
Yeah, my money, nobody received this money. My money is in there. But when they make a close family of it because of the ignorance, they don't know their numbers, some of them, they don't know.
Okay. You want me to respond first? Okay, I thought I could get over 10, then I respond. Allow me to respond to those that have just come. Allow me to start with you. What happens when somebody changes the number, or goes to a wrong account, and the rest? All those are things that are there. And I want to tie it to my sister there. Before payment starts, and this is a lesson I want also we learn together. Before payment starts, either the president or the minister or the principal secretary, they'll put a bulletin on TV and all the radio stations that cash transfer for older persons, for persons with disability, and the city OBC shall start on this day. And you'll get money in your M-Pesa. Please maintain the same M-Pesa number. That is the instruction. Don't change. Now, what happens if it goes to a wrong number? It doesn't go. That one forget. All your M-Pesa is registered against your ID. If I send you money and it does not correspond, even one digit misses, that money goes back. And the program officers are notified at the national level, not at the district level. The district don't know anything. Let's be honest. It's good to know, to understand how they see at the moment. Maybe in future it will be different, but at the moment they don't know who is getting, how much, and the rest. They get a byproduct that Mr. X got 2,000. That's a byproduct that after they have received. But there's no way money can be sent and goes to a wrong account. No way. That one forget. If the M-Pesa number does not correspond to the ID, then there's no way. So that one we have sealed. Allow me to talk about regulation, my brother, and the issue of taking people to court. Kenya is known for being taken to court. It's very popular. Yes, Safaricom, the government has 51% shares. So you need to understand that also. So in short, it's just like KCB. KCB, the government has 51% shares. It plays a bigger role. But we know that that is likely to come. So we've just been paying for the last, I think, 6 months or 7 months now. We intend to also open it up. But what is the coverage? That's another thing that we need to ask ourselves. Airtel that is there, which is Airtel money, its coverage is good in terms of telephony, but not on mobile money. That's a difference. So even if they are given a chance, not so many people want to go to Airtel because even the agency network is low in terms of money, not in terms of mobile telephony. I maintain Airtel money, Airtel's call, but I have Safaricom for the purpose of M-Pesa. So I like Airtel because the charges are low, connectivity is good, and I can be there anywhere. Even Safaricom is there, but it's slightly expensive in terms of call. But in terms of M-Pesa, it is easily accessible in terms of network, the available agents, and the rest. That's the reason why you look at all those parameters. We will still open it up to allow others to join. But first we were testing to see whether, will that be okay? Will we get the best for our beneficiaries in terms of time wasted, in terms of all the listing that I say? Will we get? Then I've talked about advocacy, very critical. We need to be advocates before even payment starts, so that the entire population that receives money is aware. Fortunately, nowadays, even if you receive money, nobody will know. Then what will happen? The physical touch, yes, it will not be there. But when we go to recruit, the physical touch still comes back. They have to come to the office again. We must also go to them and do other things. Then when we are doing the impact evaluation, we have to identify them and go there. Anytime you are doing identification, you are there. But the final process, the payment, that is where the challenge is. The physical touch kind of is distracted a bit. Next round of questions, please. Yes? Okay. All right. And that's why we are here to tell you that for you to have a better program, please have two-factor authentication, at least something that you can compare with, not just one thing. Because that one thing, you'll have 1,000 duplicates. I don't know your full names, but you can change your names 3 times. Start with the last, the middle, and go that way, and you'll get the money throughout. But that is not the real reason why we are giving cash transfer. We're giving because we want one person to get that money. But because we are all learning from one another, it's good just because I'm presenting the case of Kenya, so that you also appreciate that is the journey we went through. And by the way, that is the problem we had, I think 15 years ago. We didn't have the ID vis-a-vis the amount, especially those that are orphaned and don't have an ID below 18. So we realized there are people who are hiding below 18, and there are more than 10 in one. So somebody will get 20,000 shillings in every payment. That fellow will never go to work. He's just enjoying life. So tell me, if you earn every month 40,000 shillings, why do you have to go to work? So we learn from mistakes. So we changed that. We said, okay, if you are below 18, you must get somebody who is above 18 with an ID and does not get any other money from any government program. Therefore, we closed that gap. All these are issues that we've gone through, so that we also make sure that the best gets the money. Next round of questions, please. Thank you.
I think mine is not a question as such, but listening to you and also trying to some of the challenges that have been mentioned. For me, I see that over the years, even some of your beneficiaries have graduated over the years with all the starting with the banks and now Safaricom. You've built a habit. So this issue of, okay, I have my SIM card, I remove, and it's when you have one off today, a donor comes, gives you money, you give them a little, they don't know whether it's coming. But the fact that this is 100% tax financed by the government, it's really the strength of this program, and I really want to emphasize, I want to hear from you at the political level, why this commitment for 100% tax finance? I think you have built the habit among all the beneficiaries. You know, they know this is a government funding, it's going to come. There's no way someone will just go throw your phone or throw your SIM card away because you have built that habit. It's really a habit. And one of the things I also say, which I may be wrong, is that sometimes when we're giving people money, we're so obsessed. What are they using the money for? Well, we just need to know, has their lives changed? And I ask myself, you work and get your salary from the government. Who comes to ask you whether you're using the money very well or not? You know, we're so obsessed when we give money to poor people to know, okay, has their life changed? What have they done? Oh, they've married another wife, why should they? And all these things. So judgmental about, you know, helping very poor people. But that's my own personal. But thank you, you know, for sharing this very, very important program. And I'm sure that many countries, many member states can learn from this. Thank you.
Much appreciated. Any other concern?
So we are seriously out of time, and we need to pray, we need to have lunch, and we have another session also coming. So I will plead that, you know, we take this one as the last question, if you agree, so that you can, thank you so much. I'm saying we are completely out of time. Yes, please. No, the director will have chance to ask questions. Thank you so much.
Allow me to just respond, thank you, Madam ECOWAS. Sorry, I don't remember the name, but I remember ECOWAS, as my Nigerian friend said. Truth be told, not all have graduated. Remember, we are one of our country, and Nigeria is one of our friends. We are just like Nigerians. We are very, very, very crafty. Allow me to use that word, of course, selectively. So not all have graduated because they have learned the trick. They have learned the parameters. So if the last child in the house was supposed to be 18 years, they'll get another one, and they will still remain in the program. So you can imagine. The only thing that makes you go is when you die. So if you are, for instance, OPTC and you die, there is no, but there, some of them, they come with another birth certificate, and it's very funny. You will get somebody died and then is still in the program. All these are challenges in the program that we need to agree. But we've learned a long way, and we've been able to manage that over time. That is why we have linked ourselves to IPRS, and of course we are linking ourselves to CRS so that we can be able to address all concerns within our population. Thank you so much. We can meet outside for further discussion, and I'm ready to respond to many questions as we meet outside. Thank you.
Thank you very much, Mr. Peter. Thank you. So as we said, it's prayer break and lunch. And please let us try to be back by 3 p.m. 10 minutes past 3 latest. Thank you.